MATC has a number of programs to choose from, but one of the most popular is registered nursing. Nicole Corchado, a recent MATC grad who now works at Children's Hospital, shares some insight on life after graduation.
I work in the ICU. It's one of 3 ICUs at Children's Hospital. I am responsible for assessing a patient, monitoring their vital signs, passing medications, daily cares such as bathing, toileting, oral care.
Being a nurse, you have to be ready for anything.
We've had patients as old as 40-some years old there, but usually it's birth to adolescent. The reason we get older adults is adults who have congenital defects that don't have doctors in the adult world to take care of them. So they were born with it, but there's not doctors in the adult world that take care of, like, certain congenital heart defects are the most common things that we see.
With the economy ever changing, how strong is the job market?
When I had first started, there was a nursing shortage. So that was only 5 years ago. And then about a year ago, they had stopped hiring altogether, and I heard nurses, it was very hard for them to get jobs. And then we just hired on a couple more nurses. So I think from what I understand from nurses who've been in the field for a long time, it goes in peaks and valleys. You know, we'll be hiring a ton, and then all of a sudden we're full. So I think it just goes with the economy that it is right now, that they're not hiring as much.
With technology ever changing, you have to stay on your toes.
What we do is changing constantly. I was just on maternity leave for 3 months, and I had to go back and go, is this what we're doing now?
But Nicole hopes to go even further with her education.
Eventually, I would like to go back and get my bachelor's and master's degree. I'm not so sure if I want to teach nursing or if I would like to become like a nurse practitioner. So I have still some things to decide.
But she owes it all to one place, MATC.
MATC got me in there when I was in my clinicals, and you had to do things. They prepared you with all your theory and your background knowledge, and then you really got to use it when you were in your clinicals.
Nicole shares this message for anyone in the program now.
Stick with it. It's a lot of work. It's hard, but it pays off. I love my job.